go over there? Are you ready?
Yeah.
Good afternoon and welcome to Genesee County's press briefing for March 17th. With us today we have Dr. Martin Moore from the City of Batavia. We have Tim Yeager, Emergency Management Officer. We have Public Health Director Paul Pettit. We have County Manager Jay Gazelle. We have our County Clerk Mike Cianfrini, and we have Andrew Young, our Public Service Chair. This, folks, is all in our hands and it's all in our attitude. I would ask that you please pay attention to all of the good guidance that we are getting from our professionals. With that, I will turn it over to Paul Pettit, our Public Health Director. Thank you.
First of all, anybody who's got one of these, put it on silent or turn it off, please. Okay? First thing. Secondly, you'll notice that we are walking around and have cleaning devices. This room was cleaned from yesterday till today. Follow all the protocols that Paul's going to be talking about in the next few minutes. Also, with regard to where we are obviously in between two major metropolitan markets as far as information. Everything we talk about here today is Genesee County specific, and in some cases Orleans County specific, because we're running two health departments as well as some of our other operations and services. But Martin Moore is here also representing the City of Batavia, as are other of his professionals waiting outside in the hallway, because again, we are tightening down even the assemblage of people in our particular buildings, today being one of them, in the 10 or about number rather than even the 50 or less, because the state is changing literally what our compliance is as far as crowd gathering, or this is obviously is not a mass crowd. Also, Paul's got information, but we have a couple other general announcements that are part of what county government is going to be doing in the next few days, but I think realistically this show is going to become, as it always is, Paul Pettit's. It's yours. And also, please, anybody who has questions or comments, and we too, let's come here and stand in front of the podium.
Thank you, Jay, and good afternoon, everybody. As we talked about yesterday, this is an extremely fluid situation. We talked about yesterday our data and our numbers changing literally by the minute, and that it continues to be the case. I'm going to provide a brief situational update here and provide a little bit additional information on a few things. Obviously, we're going to have some of our additional folks share their updates and the different information they would like to share. But then we'll also be taking some different questions that may arise, obviously through this conversation and update. So, as I did yesterday, I'm going to start off with reporting our current numbers and the current situational on the ground here in Genesee and Orleans County. With that being said, first, I'd like to state that we have our first case of COVID-19 here in Genesee County. Again, we do have one confirmed case of COVID-19 in Genesee County. The individual was over the age of 65 and confirmed positive today, March 17th, 2020. The known case has had no relative relatable travel history. It's very important that we get that message out. There's a differentiation, obviously, with cases that we have been seeing around travel-related and potential local confirmed passing. So at the moment, what we know, again, this is very early on in the investigation. We literally got this result at 3 o'clock today. So we are bringing that to you, to keep you informed, to remain transparent, and to make sure you have the most current information. But again, there's a lot that we do not know yet. We're currently starting our case contacting and looking backwards to where this patient may have been and who might they have come in contact with. The individual has been on mandated quarantine while the testing was being done. Again, we got that test back today. The person has not been out in the community, has not been around other folks while symptomatic. They self-isolated, then were put under mandatory quarantine. The individual will now be under mandatory isolation. Again, we talked yesterday about the difference between isolation and quarantine. Isolation is when they are symptomatic and they are confirmed positive. So this person is now under mandatory isolation until they meet the clearance guidelines. Again, there is no known travel risk at the moment. So our epi folks and our nurses are back right now. They're currently looking and contacting and starting to talk to and develop again, looking backwards where this patient may have gone and who they may have come in contact with. We're currently looking for individuals that were exposed, and that for the definition of COVID-19 is within 6 feet of the infected individual. And when we identify those sources, again, while symptomatic during that period, they will be placed on a 14-day mandatory quarantine. And again, this is standard, and this is what we've been doing with folks as we've identified them, as they've been exposed to confirmed cases or met other criteria. They've been put into that quarantine level. The testing was done at the Erie County Public Health Lab. And, so this is very, again, late-breaking information, but we wanted to bring that to you now. We can try to answer some brief questions. Again, we're not going to be getting into the specifics of the individual. We are a smaller community, and this is no different than we do with any of our communicable disease cases. We don't share specifics because, again, we got to be mindful of HIPAA regulations and protect the health information of the individual. I do want to say that, as we said yesterday, there is always that concern that there is community spread. We just had not found it yet. So that rolls over into our testing and swabbing, as we talked about yesterday. We knew it was a matter of time, obviously, seeing confirmed cases over in Rochester and over in Erie County and other ones starting to crop up throughout western New York, that it was a matter of time before we identified our first case here locally. That has happened now. And again, now as we start into another phase here and we start to look at how we're going to respond again to this individual case and try to contain those that may have been in contact, we still need to go back to the messaging and really focus on community mitigation. As we talked about yesterday, again, there's significant movement around obviously closing down facilities, towards closing down county operations. And again, we'll hear a little bit more about some of those different assets here, different things in a minute. But the reality is we need to self-isolate and we need to quarantine ourselves when away from the others, especially when we're symptomatic. I mean, that's our key message. Stay home if you're sick. Do not go out. Do not go out into public areas. You need to stay home. The other important message, again, continues to be we need to make sure that we are calling our healthcare provider before you show up there. We don't want our folks that may be symptomatic with respiratory issues showing up in the healthcare facilities or into the emergency rooms or into the doctor's offices or urgent care. So it's very important you're calling ahead. That's extremely important. Again, hand washing, wiping things down. These are all those different interventions that we continue to talk about, we continue to push information on. So at this point, we are still working diligently and aggressively to get swabbing kits. We talked about yesterday the lack of availability locally. That continues to be the case. We do have some swab kits in the Department of Health at the moment, but not to the level that we need. We continue to put in requests daily with emergency management. Our healthcare providers, as we are hearing, it's at different places depending on the provider. Some of them have swabbing kits. Some of them are doing swabbing and sending to their own health systems for testing. Others do not have them. But again, we want you to call your provider first. That's where you should be going first, to ask them if they have that, to talk about your symptomology. They're going to be screening. And again, we need to triage. We need to look at and talk, and we need to look and swab those folks that are at the highest risk. And again, for COVID-19, we're talking about our elderly. We're talking about those that are immune compromised. Those are the ones that are being the most disproportionately impacted and affected with more severe illness. So it's very important that, I understand there's a lot of anxiety and a lot of concern, especially now that we may have, now that we have our first confirmed case. Again, I want to reiterate that although we have a positive, it's not changing our approach. Our approach still needs to remain on social distancing techniques. And again, with things shutting down and again, unprecedented moves towards trying to put people apart and get people away from each other, we're very hopeful that those preemptive measures that we've been doing now for several days and backwards, that those will be helpful and successful in trying to, again, flatten the curve and push out the illness over time here a little bit, so we're not going to be so overwhelmed potentially with positive cases. Again, in this scenario, I'm just going to reiterate that this individual was quarantined upon symptoms. They were not out in the community. They were not walking around. So we do believe that the risk is very low for exposure to this individual, and we will be, again, working with our epi and nursing staff to go out and to trace backwards and to talk to those individuals. So I do have some updates here on some other numbers real quick, although, let me see here. Nope, I need to, sorry, excuse me. I just want to give some updates on just some other general numbers, and then I'm going to turn it over to a couple other folks to provide some updates here. Maybe. All right. I'm going to let Mike Sanfrini come up and give an update on the county clerk and the DMV for Genesee County, and I will come back and give you my updates on numbers, other PUIs, so those that are mandatory quarantine, precautionary quarantine in both Genesee and Orleans County. Thanks.
Thank you, Paul. I'd just like to provide an update on the recording office and the motor vehicle office. Due to the risks associated with the coronavirus and after consultation with the relevant health professionals, the county clerk's recording office will be closed to the public effective tomorrow. That's Wednesday, March 18th, 2020. We will unfortunately not be able to process pistol permit amendments, passport applications, DBA filings, or any in-office real estate recordings. All users are strongly encouraged to use our e-filing and e-recording systems. We also have online search capabilities. If you access the Genesee County Clerk website, you can find a link to access our online records. You can also mail in any documents that need to be e-filed or e-recorded or just recorded. We will have staff in the office to answer phones, to process the electronic filings and recordings, and to handle the mail. In addition, due to the same situation that we have, the Genesee County DMV is also going to be closed to the public effective tomorrow, March 18th. We will continue to be able to process certain transactions that are submitted either through the drop boxes that we have located on Court Street here in Batavia or in Leroy, or if it's mailed into our office, we will be able to do vehicle registration renewals. If they are dropped in our drop box, we just ask that you make your check payable to the Genesee County Clerk. Make sure that they are signed, and we will get them processed, and we will get them mailed back to you as soon as possible. Driver's license renewals can also be mailed in. You will need an eye test report, which is a form MV619, or you can visit any vision registry location, and the results of a vision test will be automatically electronically forwarded to the DMV. If you just need to do a license plate surrender, you can also drop those in the drop box along with solidly affixed address to where we can mail back the receipt, along with $1. If you have a commercial driver's license medical examiner's certificate, those can also be deposited into the drop boxes. We will fax those in, and we will notify you. If you leave us a phone number, we will notify you when they've been processed and they are showing up in the DMV system, which typically takes about 2 weeks. We also remind everyone that during the period of this temporary shutdown that you are also able to utilize the New York State DMV website to do certain DMV transactions. We do regret that this has become necessary, but ultimately this is in the best interests of both the staff of the recording office and the DMV and the public in general. It's our hope that these measures can be lifted as soon as the relevant healthcare professionals deem it prudent. Thank you.
Following up what Michael just did, I've got two other releases informationally that also, again, with occupants, departments in County Building Number 1. This from the County Treasurer's Office. Due to the coronavirus pandemic, County Treasurer's Office will be closed to walk-in business effective immediately. Closure will remain in force until further notice. Anyone wanting to pay delinquent property taxes may find the amount due at our website, genesee.gov.togov.net. I may have to repeat that at some point later. Payment will be mailed into our office. Anyone owing the town of Stafford taxes may submit payment by mail based on the amount with regard to from March until that's on their bill after March 1st. then March 31st, please refer to our county website as far as the Stafford taxes. Students requiring certificate of residency to their community colleges, including Genesee County, may submit their signed, notarized applications along with photograph from their driver's license by mail. The mailing address for the county treasurer's office is Genesee County Treasurer, 15 Main Street, Batavia, New York, 14020. Vendors looking for payments from Genesee County will be notified that there may be a delay as far as that's concerned. They will do our best. We will do our best to process and deal with the circumstances as everyone understands and what we're dealing with as of today. It's also appropriate that, again, as far as the county treasurer's office is concerned, that they can be contacted by phone, 585-344-2550, extension 2210. Division of Elections. Beginning as of Thursday morning, Genesee County Board of Elections will be closed to public traffic due to the COVID-19 epidemic for the safety of the voting public, also with regard to voter registration forms, for registering to vote, or for any of the following changes of address, name change, party enrollment changes, as well as the as well as the absentee ballot application can all be addressed to their website can be accessed through their website, and also dropped off at the DMV drop-off on Court and I guess center, but also there's others in the rest of the county. Those will be collected both for DMV as well as absentee or any voter registration issues that people want to submit in that manner. The forms can either be mailed back to the County Board of Elections at 15 Main Street, just like the Treasurer's Office, Batavia, New York, or placed in the drop boxes, as I just said, that's on Court and Court Street next to County Building 1. Once again, what we're trying to do is deal with the issues as far as some continuity of business, but also providing both some safety with regard to crowds and or gatherings of people, but also with regard to the nature of what our workforce that we're dealing with, because we also have the mandate to reduce our workforce approximately by 50% within the next few days and submit a plan to the state of New York, hence why we will not have the kind of staff that people are used to dealing with in the clerk's office, DMV, county treasurer's office, and also obviously with regard to the boards of elections. In fact, most of their staff, aside from communications technologically and telephonically, we'll be actually locating out to County Building 2, where all of our equipment and our technology is centered anyway with regard to our voting machines. Martin, you have any insights or updates for City of Batavia?
Actually, we do have a couple of updates for the City of Batavia. Excuse me while I put my eyes on. The City of Batavia, effective 4:30 this afternoon, we have declared a local state of emergency for us, following in the shoes of the national, state, and county declarations. To let you know specifically what that means for us as a city and for you as residents, number one, the Liberty Center for Youth will remain closed until further notice. Two, all city offices are closed to the public. In other words, walk-ins are not allowed. The city will conduct business with the public remotely through the use of phones, computers, mail, and other means. These offices are otherwise closed to the public unless a situation requires interaction with a member of the public is determined by the respective city department on a case-by-case basis. Our drop box, a reminder for the payment of bills, is still available at the front of City Hall. So you can come to the front of City Hall and drop your payment in a drop box if you absolutely need to. City council meetings will be closed to the public until further notice. Provision will be made for the public to observe or otherwise, be able to either see or hear city council meetings as they go on. All other regularly scheduled board, committee, task force, or other official city meetings are closed to the public and shall either be conducted by electronic means or canceled. And those notifications will come out by notice from the City of Batavia to the appropriate affected parties so that they are aware. And finally, city parks. City parks remain open for public use, provided that the state of New York declared restrictions on congregating are followed. However, all rentals or reservation uses of city facilities are suspended until further notice. This includes parks, sports complexes, buildings, roadways, or public parkways that are owned and or operated by the city of Batavia. And also, our departments, as they come up with information, they're providing and sharing, and I wanted to share some from our fire department, because I'm sure that there are some questions and concerns in relationship to how do they respond, particularly, on fire and medical and those type of calls. First of all, their safeguards are going to be in place. They remind us and ask me to remind you that if you have an emergency, call 911 immediately. The fire department will be dispatched to you as normal. He emphasized emergency. Obviously, if you have normal calls, follow the county health director's direction on calling your doctor or medical provider. The fire headquarters at 18 Evans Street, since we are closed to the public, is locked and secured at all times, letting everybody know that it is a secure building and environment for our firefighters, and a reassurance to the public that it is secure. Anyone requesting assistance or information can utilize the phone located in the front vestibule of the station as they come in, and they will contact a member of the staff and see how they can assist you appropriately. Again, the guidance in the direct declaration that we have provided is in force. They have to make a case-by-case decision on if they need to deal with a situation, but when they do need to deal with a situation, they will be right there and immediately available. All outside activities hosted at the fire department and the firehouse have been canceled, as well as many internal programs, that aren't critical or necessary during this time, particularly with the announcement of a confirmed case now here in Genesee County. They've adopted revised EMS responses in an effort to protect staff and the community. They are continuing to respond to medical emergencies. However, the appearance along with the patient contact of our staffing is going to be modified to address the things like social distancing and those types of things and the guidance from our county's public health officials. Our community risk reduction programs, including car seat inspection, installation, commercial building inspections, EMT and CPR classes, along with fire prevention and education, have been suspended until further notice. However, this does not include their smoke detector installation and inspections. Please call 585-345-6375 if you need to schedule an appointment for fire department staffing to inspect, install, or change batteries in relationship. And again, we are going to be following proper protocols, and I'm sure they'll be asking you questions and making sure that it is appropriate and healthy and safe for our people to be able to go in. If you're in need of a copy of a fire report, you also need to call 345-6375 to be able to get that, and then they will give you directions on how to proceed with your request to be able to get a fire report. If you need to speak with a fire officer or the fire chief, we ask again you call that same number. Here's the commercials, they tell you say it 3 times, here's the 3rd time, 345-6375. And the fire department staff will be able to forward you to the appropriate person. If you don't get immediate assistance, staff will obtain your information and someone will be in contact with you as soon as possible. And they also encourage the public to continue to remember to stay safe, and that our fire officers are very well aware of certain situations and things that are going on, but also of the need to make sure that the public health and safety is taken care of. So with that, that's all I've got for now.
Tim, Martin, McCock only had to vote 2 times in the Bible, so Stefano's even above that.
There has been no adverse effects to public safety as far as first responders are concerned, so we continue to provide full level of public safety first responders in Genesee County. We continue to brief them on the proper personal protective equipment that they need to be issued and carrying and when they need to use that. We continue to fulfill orders both for public safety and for the healthcare system. And that's a combination of requests that are being made to New York State Department of Homeland Security and Emergency Services, as well as we're using and leveraging our vendors locally the best that we can. Those requests have been very, very slow getting those required equipment to Genesee County as the area. So this whole region seems to be kind of on a slow roll. There is stuff coming in, but not anywhere near to the speed that we would like to see. So we continue to work, again, with all those healthcare agencies, all the first responders on a daily basis, and making sure that they're protected. And again, there has been no reported adverse effects as far as staffing or capability of any emergency services within Genesee County.
Tim, can you elucidate just a little bit when you mean, are you talking PPEs? Are you talking certain sanitizing things or the N95 masks, that kind of stuff?
Yes, it is. Obviously, the hand sanitizer is something that the governor was offered to every county in the state, and that's been ordered, and it still remains to be on order. So we're trying to make some accommodations the best that we can, based on the fact that that has not been delivered yet. So it is at a premium. As the health director also alluded to, that the swabs have been ordered, and we're waiting for those and looking at that order and where that is in the system, minute by minute, to make sure that that stuff comes in. As far as PPE, as far as gowns, Tyvek suits, safety glasses, things of those nature have been delivered, and we're in the process of right now is distributing those out to basically replenish what's been used.
Paul, the podium is yours.
Thank you. And again, just to reiterate what the city manager and Tim Yeager, our emergency management officer, said, it is very important that you are protecting our first responders as best we can. We only have so many of them, right, in our communities. And the last thing we want to do is have them removed from the response field, right? So it's very important that if you are calling, and again, life-saving emergency, we need to call 911, we need to respond to that incident. But if they're not life-saving situations, we need to make sure we're protecting our folks, so when they do respond, they're showing up and they have the proper PPE on. Because again, if they get exposed to confirmed cases, we're now going to lose them out of the response field, which is going to create a shortage. So we want to make sure that, again, the public is well aware and helping to protect, our first responders, because we're going to need them during this time to assist us as we move forward. As I was mentioning when I was finishing up, I just wanted to provide just a brief narrative on the other mandatory and precautionary quarantines. So in Genesee County, beyond the one confirmed COVID-19 case, we do have 11 people under precautionary quarantine. We also have one person, two people under mandatory quarantine, and then obviously the one under mandatory isolation, which is the positive case. In Orleans County, updated from yesterday, we have 0 that are under precautionary quarantine, and we have 5 people that are under mandatory quarantine. And we do not have any positives, again, 0 positive cases in Orleans County. So again, as we talked about yesterday when trying to identify and understand, what the true impact and level of cases are in our community, we will be reporting these to you. They will be updated on our website. So again, go to our website, Genesee County Health Department or the Orleans County Health Department sites, and those will be updated daily at 5 o'clock. We'll have the most up-to-date precautionary, mandatory, isolations, and confirmed cases. So if it's not on there, it is not true in our counties. So again, rumors and things flying around, we just want to make sure we're transparent and we're providing you guys the most up-to-date current information that we can. So with that, if you guys have any questions for any of us up here, we're happy to try to answer them for you.
Speak loudly, as loudly as you can.
I was going to also ask a favor. Could you repeat again the confirmation of the case that we have?
No, absolutely. So we do have one confirmed case of COVID-19 in Genesee County. And again, this person is of the age above 65 and was confirmed today on March 17th, 2020.
And I think you said earlier he'd been in mandatory isolation prior to the confirmation of this.
The individual was in mandatory quarantine once they became symptomatic, and they have remained there and have been very compliant. We've been checking on the person daily, and now they are under mandatory isolation.
You mentioned there's 2 other people under mandatory quarantine right now.
Mm-hmm.
Is there any indication that these 2 individuals had contact with the person who's not confirmed?
No, at this point they are separate cases or separate quarantines. Again, this is late breaking, so we're right now starting that contact tracing. So at the moment, these are separate individuals, again, that have met the definition for mandatory quarantine.
early, you may not have this information yet, so it's a two-part question. One, what do you know about what contacts, where this person might have been in the community prior to going into quarantine, because there may be probably a carrier before that. And two, will you release information to the public once that's known, so people might know that, hey, I was at X business on this day?
Yeah, so again, we're just building the story, right? So part of epidemiology, when we get these confirmed cases, we have to go backwards, right? We have to try to identify those, and we are literally making those calls as I'm speaking right now. So I really can't comment, with any validity of where the person may have been prior to becoming symptomatic and actually where they were in the community. At the moment. We will, again, be assessing and looking at where the story takes us, because, right, we have to investigate this and try to figure out and build those contacts. Obviously, you've seen in other cases in surrounding counties, depending on unknown, if they were at an event, at a church service, at a faith-based event, if they were at another community event. Those are areas where there would be more of a global ask, right, if you happen to have been at that event where we don't have specific information on the people there, where we would look to the public to maybe come forward and potentially be, case contacts.
A question I didn't get a chance to ask yesterday, I'm sorry. A question I didn't get a chance to ask yesterday, and you talked about, building the case. How are you on staffing to deal with, doing this investigation to find those contacts? And then also, on the quarantine, I think isn't there a process where you go daily and collect swabs to check to see how's the staffing on that?
Yeah, so I appreciate the question on the staffing. My staff back in the health department, they're first class. We have great folks that are working for our counties, not just in the health department, but from all these departments and folks that represent you. They work daily to protect and to provide services to our residents. They're holding up. It's been busy. It's been busy this last couple weeks, particularly when we started seeing cases here across New York State and now cases locally. They're working very long days and they're doing their job, and they're happy to do their best to protect our residents and make sure that you guys have the most recent and up-to-date information. But it is something that we're monitoring and making sure we're trying to, again, keep those in mind. We want to avoid burnout. We want to make sure that they're staying healthy. Another big concern, obviously, is if you have, some exposures or some cases in any of our staff, but particularly those that are responding and on the front lines of this, that can become problematic. So we're really working hard to keep our folks healthy, to keep them with the energy and the stamina to be able to respond to this over the next few weeks and months. The second question was?
Do you do swabs on people in quarantine?
Okay. Yeah, so as far as the swabbing, we do not. So when you're in quarantine, you're well. You're not symptomatic, so to speak. So we are not doing swabbing on those folks. What we're doing is mandatory daily checks if it's a mandatory quarantine. And we are going out there once a day. We're verifying that they're being compliant with the quarantine. We're also calling them once a day. And when we do that, they're checking their temperature. We're asking them if they have any type of respiratory symptoms. And that's how we're monitoring. If they report that they are symptomatic during that quarantine period, that's when we would swab them to see if it is COVID-19. And then again, if they're positive from that point, they move over to mandatory isolation.
Paul, just a clarification.
Repeat his question.
Precautionary quarantine, 2 more mandatory quarantine, 1 more under mandatory isolation. So total of 14 people we're talking about there.
My math adds up to, 13, 14 people. Yep,
Okay.
you're good. Yep.
The question about the person under mandatory isolation.
Yes.
Is that person hospitalized?
No, the person is not hospitalized. Again, they are at home. They've been at home since they got put in mandatory quarantine, and they remain there and stable. They're not under any severe respiratory distress.
How long is that person?
Speak up.
How long is that person remaining in quarantine? And do you have any other interaction with them as a staff? The one person from the positive case.
So the question was around the person in mandatory isolation, the confirmed COVID-19 case, and how long they're going to be in isolation?
Oh, yes.
Okay. So the way this process works now is we're actually following the CDC guidelines in New York State. upon clearance. So essentially, it's a minimum of 7 days following the positive test result. And they have to actually have 2 clearance samples after 7 days, 24 hours apart, that are both negative. So if you look at that from a time period, it's going to be a minimum of 8 days. Again, that's assuming they test negative after that those initial tests or those initial swabs. They also have to be fever-free without any type of fever-reducing medication.
Other questions? Please.
The individual, is this person, they have family at home, and talk about how this impacts the family and what they're required to do, or whoever the caretaker?
Yeah, so fortunately in this case, there are other folks that live. It's a building where there's separate living arrangements. So again, this individual has been, again, under quarantine and separated, so there has not been a contact that we're aware of. Again, we're still investigating a little more going backwards, but at the moment, again, there's no known contacts to others in that dwelling at the moment.
Probably my last question, just, our restaurants are shut down. I talked to one restaurant owner, he's hoping that delivery is going to maintain 15% of his business, and it's going to be a big
Sure.
impact on at least a segment of our population. And which reminds me, Jay, I'll have another question for you. But I think it might be good to reemphasize why this policy is important.
Yeah, so again, what we talked about yesterday, what we've been putting out in our press releases leading up to this, the main goal here is to get folks apart from one another. So obviously restaurants, movie theaters, other places where people gather on a regular basis, again, we have large groupings, 30, 40, 100 people together. And again, what we know about disease transmission, again, airborne disease transmission, if we have folks together, if we have folks congregating, this virus can be passed easily. We know it's within 6 foot close contact. We are hearing, again, these are preliminary understanding of the virus itself, that it can stay potentially alive and airborne for up to 3 hours. So if you think of those different aspects of this virus, it's very hardy. That we need to get folks apart. We need to flatten the curve. We need to push it out. We know we're going to see more cases. I mean, that's to be expected. We've seen it in other communities. We know that the R0 or the replication of this is over 2. So typically, under normal circumstances, when somebody's exposed, they're going to infect at least 2.2 additional people. So with that in mind, the goal here is to get folks apart so we can lower that number, flatten the curve, push it out, and free up our capacity in our healthcare system so we can, again, handle those folks over time.
Is it also safe to say that there is a New York State directive from the executive and an order that talks about establishments, particularly restaurants and gathering places where meals are served, that we are following the guidelines and the dictates? Mm-hmm. We have not made up our own set of rules and regulations.
Yeah, absolutely. I mean, these are national, state guidelines. Obviously the governor has been changing the playing field for us, so to speak, daily, hourly, sometimes. So again, these responses are in line with what he is mandating out of Albany. But again, on the public health side, it is in line with the goal of extreme social distancing.
The governor mentioned today that we're not flattening the curve based on his math. What's your sense of that?
Well, I can't comment on his math. But the reality is, again, we've been preemptive here. This is our first confirmed case, and the goal here was to try to put these extreme measures, these unprecedented measures in place prior to getting cases. Obviously, that's kind of coinciding at the same time. The goal here is that by getting people apart now, if we do identify cases, which is extremely important, to again isolate them, keep them from spreading it to other people, we can hopefully again slow it down and keep it contained. We don't have folks out in the community.
On the businesses being closed, the directive that came down on that, have there been any reports of any businesses, restaurants or bars, not complying with that?
Yeah, so the question was around businesses not being compliant, and I think it's important to really say to folks, again, there's different opinions on whether this makes sense, this is overreacting, et cetera. The reality is this is a directive, this is a mandate, this is what we need to be doing now. We do have local cases now. We do believe it's community spread. And we really are asking folks to be compliant. We need folks to listen and to adhere to the guidance. Again, we talked about yesterday protecting others by protecting yourself. We want to make sure that restaurants and establishments are adhering to these guidelines. You're not doing anybody any favors by going against that guidance. Again, if we're bringing folks together, that is not what we want to be doing. We want to try to isolate, and hopefully this will be short-lived, right? Nobody wants this to be prolonged. We want to be able to move past this, but in order to do that and to flatten that curve, we need to be compliant and make sure we're adhering to the guidance that's put out there.
I'm getting a lot of people on
Speak up, Alicia, please.
I'm getting a lot of people on my page telling me they're frustrated by calling their primary care.
Understood. Yeah.
They're not getting anywhere because they don't have the test. They're told to call the health department, go to the emergency room, which is exactly what you're telling them not to do.
Yeah.
What can you tell them?
Yeah, so I want to say I hear and I appreciate your frustration. We're frustrated. The reality is, as I've been saying, we are being as aggressive as we can to get these swab kits. Working with Tim and Dale Banker up in Orleans County, we are putting in orders every day trying to get these. And we're not alone. If you look at all the other counties in western New York, we are all screaming for these swabbing kits. And the guidance still is to go through your primary care provider. You got to remember, again, as we continue to talk about influenza, seasonal flu is still prevalent in our community. Just because you have respiratory illness does not mean you have COVID-19. Again, first case, potentially some community spread here, but again, more than likely, most people that are dealing with respiratory issues is not COVID-19. So we want to get that screened out. Providers can still screen for influenza. All right, so they can still check and make sure. So if you get a positive test back for influenza, that more than likely is the result of the respiratory issues.
A lot of people are saying that it's your first case because you haven't been tested. That's what I keep
Understood, and I appreciate that, and we do recognize, and that's what we said, when we're able to swab more and test more, we will find more. And we are doing our best. We want people to be as patient as they can. We understand the anxiety is there, and we are doing our best. We will have more information as soon as we can around, maybe community swabbing locations, those drive-through swabbing sites. We're currently developing those and putting them together. We'll have information on where those will be and when they'll be and the criteria. The other thing I would ask is that people continue to be understanding and patient, that we need to really focus on those that are adversely impacted, and that is our elderly, and that is those with immune-compromised health issues. So, if you're healthy and you're symptomatic and you're looking for the swab, we're going to try to accommodate you, but we need to, again, put our resources where we know they're being hardest impacted.
You mentioned earlier about reducing the workforce, and you said basically cutting the workforce in half. What about things?
The two things, we're still putting our plan together on a department-by-department basis for the entire county as far as our regular 542 people. We're trying to seek clarification from the state as to whether or not, as we do that, our emergency services and our critical care people like Health Department, Sheriff's Office, EMS, and those people are or are not in what they consider our calculation of a 50% workforce goal of reducing or getting to. Based on both state and federal legislation, what's either in place and or what is likely to be in place, no employee who is not working at their particular desk or counter or whatever will lose any pay. All people will be on paid leave throughout this issue, whether or not they're working at home, whether or not they are just at home, or whether or not they're coming in and cycling through our various operations. So there is no issue with regard to any employee working presently for Genesee County government not getting paid throughout this entire process. We have a process in place. It's been identified by our Treasurer's Office and our HR department as to how we'll code that, because we're also going to keep track of all our expenses because of the state and federal funding, including potential FEMA funding that may come through that may help reimburse us for some of the extraordinary costs that we may incur by virtue of responding to COVID-19 and the issues surrounding it.
You kind of anticipated one of my questions to this, we look for federal governments. I'm sure you're calculating a big revenue.
Well, certainly as far as sales tax is concerned. However, like I said, particularly with FEMA, we don't know exactly what the 38 million or the 40 million that the state's put in play, or the 38 million coming from the first outlay from the feds a week or so ago, whether or not that is going to be like with FEMA aid, which is for extraordinary expenses above and beyond your normal routine daily operations. So that's usually overtime, mitigation, and heightened response and things of that nature. Those are the current FEMA guidelines. I've not heard anything that's going to say any differently from that. As you do know, the state of New York and the Senate at the U.S. level and the House of Representatives are dealing with legislation that deals with the Medicaid issue as well as emergency aid. That has still not been, so to speak, finalized. And that is part of what we, obviously, as a county are paying attention to, and our state representatives and our advocates in Albany and NISAC in particular are keeping us apprised of where and when that may play out and how that will play out, very likely by the end of this week.
When do you hope to have a plan in place?
Our plan for how we're adjusting our workforce will be definitely effective as of the first thing Thursday morning. Again, it's a moving part. We got a lot of different departments, and again, we're trying to make sure that we also have some kind of semblance of how these people will be impacted in terms of can they work remotely. We have technology, but as you all know, or at least many of you know, when we put somebody out at their home and say, can you work at home? If they live in Alexander, that isn't going to be able to happen if they need a computer and they need access to the internet. I'm not sure they even have dial-up service down there anymore. So that's the kind of thing that we are telling and asking our people to let us know. It is changing also. Just anecdotally, we know that Time Warner, Spectrum, Charter, whatever they're called today, are putting out their next plan as far as extending under the compact with the state, the 140,000 new services in New York State. There is a plan for doing that here in Genesee County for that portion that is committed to this county. That has not happened yet. So we know that there are going to be gaps, and some of our employees live in those gap areas, as do a number of students in the school districts. So those are the kind of things we're trying to factor in as we put this plan together as far as adjusting our in-present workforce.
Andrew has something to say.
Beyond the facts and figures, I think the most important thing about this press conference should be that people heed the warnings and follow the guidelines and the mandates. The only way we're going to get ahead of this is to do that. It's a short-term sacrifice for a long-term gain. The more we can do that, the better off we're going to be, the less trouble we're going to have down the road. We live and are fortunate enough to live in a country where our freedoms are very dear to us, and I understand it's hard to do that, but I think for all our sakes, it's going to be the thing we need to do. So again, all of this information was important, but I would suggest and I would ask the press to make sure that you emphasize the fact that the guidelines and the mandates, although cumbersome and difficult, are what's going to get us through this or lessen the likelihood of this being a bigger issue.
I'm glad you stepped forward because you're a small business owner too, and I've read that you have potential impacts on your industry, real estate. Just what do you have to say to other small business owners?
You know, I don't have much more to say than we got to roll with the punches. Nobody's asking for this. Nobody wants this. Nobody's really the cause of this from our perspective. But we're going to have to play it every day. I've been working with my people in regard to making a plan and figuring out, trying to forecast how bad it's going to be and what we can do on the expense side, because we know the revenue side's going to go down. So certainly we're thinking about it and planning it, but I don't know that I have a good answer for that right now.
Andrew, what do you say to the employees of small to medium-sized business? They don't work, they don't get paid. If you work for Genesee County, it doesn't seem to matter. You're going to get paid no matter what you do.
You understand the concern. I am confident that we're going to be able to, from the federal level, mandate or fix some things. I've heard some things from the federal level that they are immediately going to start to send out some checks and try to help the people in that regard. Again, this is a bad situation, and your question emphasizes that. I understand that. We're going to have to get together and make sure we're doing everything we can to help the people that are going to be needing help, and that's going to might be all of us at some point during this process.
Okay, thank you
Thank
very
you
much.
all very
We're going to
much.
do this again tomorrow at 4 o'clock, same place, same location. And again, if you have any follow-up questions, you know who we are and how to get a hold of us. Please do that. Thanks.